Hi, I'm Dr. Berenter, and what we're going to show you today is our newest laser that we use for heel pain in particular, as well as any soft tissue injury like Achilles tendonitis, plantar fasciitis, ankle sprains. Actually, even for diabetic neuropathy, it's helping in that condition as well too. This is a cutting edge laser. It's a class 4 medical laser. That's the latest in laser technology. What it does is it works on the mitochondria in the cells, and the mitochondria are what makes ATP, and that's how we start to power intracellular damage in terms of the repair process. It turns the repair process on. This laser is fully robotic. It has no side effects whatsoever. It doesn't hurt when we use it, and it's been incredibly helpful in turning our patients around in terms of getting them back to their activity very quickly. We'll show you how we're going to use it here real quick. One of our patients with an ankle sprain, and you'll see how easy it is to use. It typically is 6 or 7 treatments. Usually our patients experience a lot of relief after the second or third visit, and then we'll show you here how it works. So our staff has extensive training in the use of this machine, and they set it all up for us. The laser's completely pre-programmed for a wide variety of treatment options. On the right position, the laser basically does all the work for us. Average treatment time is usually about 4 to 6 minutes, and patients go right back to their normal activities for that day. Usually we do 2 treatments a week, and again, usually it's 5 or 6 treatments depending on the condition. Sometimes 10 if we're dealing with particularly difficult nerve problems. But for plantar fasciitis and heel pain or Achilles tendonitis, usually 5 to 6 treatments is plenty, and we're getting probably about 90–95% cure rates with the laser. So what we do is establish a grid, meaning the area we want to treat, and then the laser continually goes over that area that's involved all on its own. So we get really good coverage of the entire area. No pain with this. Patients don't feel anything. Nothing afterwards other than that the pain they're having with whatever problem it is should again start to subside usually after the second or third treatment. One of the biggest advances I've seen in my 25 years of doing this is an incredible piece of machinery. We're really excited to get into the office. Staying really busy with it because it helps such a wide variety of problems. Has a handheld component too, where if we really want to focus in on an area, we can supplement what the robotic arm does with a handheld piece. My staff will apply sometimes, particularly on the bottom of the foot for fasciitis and heel pain. Yeah, it is. So that's the handheld component that we can do and apply in particularly sore areas. Treatment time 4 to 6 minutes, somewhere in that range, very fast. Again, one of the simpler things we do in terms of time, in terms of the patient, how they feel, since it doesn't hurt at all, but one of the most beneficial treatments for any of these soft tissue injuries we see in the foot. Again, mostly plantar fasciitis, Achilles tendonitis, ankle sprains like you're seeing here. Works incredibly well at getting patients back to full activity. If it's a really acute ankle, sometimes we'll do 3 times a week if we can get our patients in that quickly, but twice a week is more than sufficient for the healing. If you'd like to learn more, I'd advise you to go to the company's website. It's called Cutting Edge Laser, or stop in the office. We have several brochures and literature on the laser.